Hi everybody, Patricia here, the diabetic nurse for maternity, with a little video about glucose tolerance tests or GTTs. This is a test we do in pregnancy to diagnose gestational diabetes. There are a variety of reasons or risk factors that your midwife will identify at your booking appointment, such as you've had gestational diabetes before, you've had a previous big baby, polycystic ovary syndrome, you have a high BMI, or fertility treatment. Usually the glucose tolerance test is done at 24 to 28 weeks gestation. However, some women may come early at 18 weeks and may need the test repeated later in pregnancy. Also, some women may be referred if we find sugar or glucose in your urine. The test requires you to fast for 12 hours before your first blood test. So fasting from 10 p.m. the night before, as the test usually starts at 10 a.m. You may drink sips of water only. You must not smoke, chew gum, or take things like Gaviscon. The test takes 2 to 3 hours in total. You come into hospital and the midwives take a sample of blood. This is a fasting sample of blood that tells us the level of sugar in your blood when you are fasting. You will then be given a sugary drink to drink over half an hour. It is really sugary and can be a little difficult to drink on an empty tummy, so please do your best. After that, you're asked to take a seat in the waiting room. It's important that you do not rush around during the glucose tolerance test, as this may impact the overall results. You come back 1 hour after the sugary drink and your blood test is repeated. This lets us know how your body has responded when we give you this sugary drink. You are then asked to take a seat in the waiting room for a second time, and after another hour you come back for a third blood test. This allows us to see if your body has produced enough insulin. If your readings indicate you have gestational diabetes, the midwife will call you with your results. You are then booked into the gestational clinic and you're seen by myself and Professor Lou, the diabetes doctor.